As Singapore approaches the end of the stabilisation phase this Sunday, November 21st, have we managed to keep our COVID-19 situation under control? And are we ready to take our foot off the brakes and ease restrictions? At the last press conference on Monday, co-chair of the COVID-19 task force, Lawrence Wong, said that they'll give an update early next week on Singapore's next steps. Now, this comes as the Health Ministry reporting last night that the overall ICU utilisation rate was at 58.8%, down from 62.6% on Wednesday. 113 ICU beds are occupied by COVID-19 patients, with 60 critically ill and intubated, and 53 unstable under close monitoring. Another 140 ICU beds are occupied by non-COVID-19 patients, and 177 beds are empty. Meanwhile, 2,038 infections were confirmed last night, comprising 1,964 in the community, 67 from the migrant worker dorms, and 7 imported. The weekly infection growth rate was at 0.90 yesterday, the 6th straight day it has been below 1. For a closer look at the current situation, I'm joined by Professor Teo Yik Ying, Dean of the Swee Hock School of Public Health at NUS. Welcome to the show, Professor. Professor, in the past 2 weeks, daily case numbers and the weekly infection growth rate have been largely constant, and the ICU utilisation rate has been on the decline as well. What does this signal to you?
Thank you for having me. The utilization of the ICUs have actually indeed been falling over the past few weeks, but this is driven in part by the increase in the number of ICU beds, which is now about 430 beds compared to only around 360 in October. So there is an increase in 70 ICU beds. So the positive news is definitely there are fewer people falling seriously ill from COVID-19 compared to a month ago. But while there's this focus on the weekly infection growth rate, I would just highlight that this is actually a very crude metric, which has very little bearing on the utilization of hospital resources. Because at this stage, the daily number of infections is undercounting the number of actual infections happening. Given that with such a high vaccination rate as we have in Singapore, many people who are infected will not be tested with PCR tests to confirm. And as such, these infected cases are not actually reflected in the daily infection numbers. And given that the weekly growth rate is really calculated off the daily number of infections, it's not really a useful reflection of the situation in the hospitals or in the community. And all it takes is for an unfortunate outbreak to happen in settings frequented by seniors and frail elderly, and we will start to see a surge in the number of hospitalized cases again that may subsequently require ICU care. So I've painted a cautionary picture, but at the same time, I think there is this positive news that I mentioned earlier on that is worth noting. There are indeed fewer people falling seriously ill from COVID-19 now. And I certainly hope this trend will continue, especially as more people come forward for their booster jabs.
Professor, Singapore's current stabilisation phase is slated to end this Sunday, November 21st, before a review on whether curbs can be eased or not. Based on what you've just said and on your assessment of the situation now, what can we expect?
So actually, there's already been some easing announced in the past 2 weeks. For example, permitting up to 5 people from the same households to dine out, and with further relaxation of the restrictions for large conferences, meetings, concert events. There have also been further announcements on border reopening, as we have seen, with the additional VTLs to Indonesia, India, Malaysia, and even 3 countries in the Middle East, Qatar, Saudi Arabia, and UAE. So I think in terms of relaxing more curbs, I suppose right now, most people are thinking whether it is time to allow 5 vaccinated persons to take part in social activities, to dine out, regardless of whether they are from the same household or not. And actually, in my own personal opinion, is that Singapore can proceed to experiment with letting 5 vaccinated individuals to mingle, especially since this will make life a lot easier for eateries, for restaurants, that they just need to verify vaccination status instead of currently they have to even check the primary residence of the customers. And actually, I do think that we can also permit more outdoor recreational activities, such as maybe sports, camping, barbecues in our parks again, but of course, with some restrictions on group sizes and definitely on vaccination status. Overall, I believe some further easing can be made, but this should still be restricted only to fully vaccinated people. And those who have yet to be vaccinated, despite being eligible, should still be restricted from most activities in public spaces.
Professor, on the point of easing, let's talk about Singapore's step-by-step easing. A high vaccination rate, a healthcare system that's not overwhelmed, and a weekly infection growth rate below 1. It seems to me like we are already there. So what could possibly derail our reopening plans?
So actually, of the three factors you mentioned, high vaccination rate, healthcare system that's not overwhelmed, weekly infection growth rate below 1, honestly, I think it's really accurate to focus at this point on the high vaccination rate. Because, for example, even though the ICU utilization has fallen below 60% as of what we saw yesterday, the reality is that our healthcare workforce has been the one holding the fort throughout the past 22 months. So I wouldn't really say that our healthcare system isn't overwhelmed, but more along the lines that we are still relying on our healthcare sector as the last line of defense. Every time we relax our restrictions and things go wrong, the healthcare sector is the one holding the fort. And I mentioned earlier on how the weekly infection growth rate is not really that great, and at best a crude metric to really gauge the current situation. So if it comes down to it, I believe what is able to allow any country to reopen in a sustainable manner will still be the vaccination rate, the way that boosters are given, and to a certain degree, the number of natural infections that's happening in the population. Because otherwise, I think what we are seeing in a number of European countries right now will repeat itself globally. Because many of these European countries, they have achieved 60, 70, 80% vaccination, and they open up in quite a big way, only to realize that the healthcare system will come under tremendous stress, like right now what we are seeing in Germany, in Netherlands, in a number of European countries. And that's because disproportionately, the unvaccinated people, the 30%, 40% that are unvaccinated, are the ones that are exerting a lot of pressure on the healthcare, disproportionately. And we see many European cities now reintroducing some lockdowns and even some outright bans for those that are unvaccinated because their healthcare systems are coming under a lot of pressure. So really, I think when it comes to talking about derailing our reopening plans, certainly we shouldn't be overconfident at this stage and to think that we are ready to open in a big way. I think as mentioned earlier on, all it takes is an outbreak to happen in a few settings, and suddenly we see a surge in our hospitals. So we certainly don't want any new variants to emerge that subsequently become resistant to the vaccines the world is using. Then this will truly derail the entire world in terms of opening globally. At the same time, I think we know there will be more travelers entering Singapore, particularly over the coming December months. And remember, December, January, and February are the winter months. So we do worry about a concurrent surge in influenza infections that will also see a return of hospitalizations because of influenza. So in summary, I think things are beginning to turn a corner in Singapore, improving bit by bit. But I do think we can continue to be cautious. Maybe just open up to 5 vaccinated people for socializing, dining, a bit more outdoor activities, and maybe a few more VTLs. But overall, we do need to be prudent.
Thank you, Professor Teo, for your perspectives. Professor Teo Yik Ying, Dean of the Swee Hock School of Public Health at NUS.